Welcome to Bruyere Continuing Care, a multi-site academic healthcare organization providing a wide range of services within our hospital campuses, our long-term care homes, and in supportive and independent living for older adults and vulnerable populations. With over 1,000 beds across the city, we deliver a wide variety of services in aging and rehabilitation, brain health, medically complex, palliative, residential, and primary care. Our hospital programs focus on helping patients restore their independence and function, providing a bridge back to their homes. This virtual orientation will help give you and your loved ones information on what to expect during your stay.
This is the Inpatient Stroke Rehabilitation Unit at Elizabeth Bruyère Hospital, located at 43 Bruyere Street in the Byward Market in Ottawa. We are a 33-bed specialized stroke rehabilitation program. Having a stroke is a major life-changing event for both the person who suffered a stroke as well as the family and friends who support them. Stroke rehabilitation is an important part of recovery after a stroke.
Stroke can be a year-long process or even longer. A critical time for rehab and recovery is during the first few weeks and months. You are here in our stroke rehabilitation unit to work on the skills that have been impaired when a stroke affected part of your brain. The brain is able to make up for functions lost by the damaged area. It does this by reorganizing and rewiring itself. The ability to do this is so exciting. It's called neuroplasticity. The goal of our stroke rehabilitation program is to help you recover as much function as possible and improve your quality of life. We want you to participate in all of your therapies and work as hard as you can. Recovery takes time and patience, and sometimes it can take weeks or more for your efforts to turn into noticeable progress. Stay positive. Please remember that it's normal to feel fatigue, sadness, or to be frustrated along the way. Talk to your team member, your nurse, your speech-language pathologist, your occupational therapist, your physiotherapist, your pharmacist, your hospitalist, your physiatrist, your social worker. They're all here to help you. You need plenty of rest right now for your body, so you may take naps during the day for your body to heal and retain what you were learning every day in your various therapy sessions. I wish you much luck, and remember, you got to keep doing it. Thanks a lot.
In the first week, you will meet most of the members of your rehab team. The focus is on getting to know you, determining your goals, and establishing your treatment plan based on what is important to you and what type of stroke you had.
The physicians, nurses, and other team members will complete initial assessments, ask you questions about your health, and start to establish a care routine with you. The first thing your therapist will do is complete initial assessments. Ensure that you can transfer safely in and out of your bed, use your wheelchair, and your walking aid, as well as the commode or toilet. These first few days are about getting to know you and your needs, and how best we can support you on your recovery journey. Over the following weeks, your rehab team will meet weekly to discuss your care plan and review your progress. These are called team rounds. A discharge date will be determined and communicated to you during your first or second week. Length of stay varies individually based on your age, severity of stroke, and other factors. Your stay could be between 1 and 7 weeks, with the averaging being 4 weeks. During your stay, you can expect to have therapies every day from Monday to Friday with a specialized rehab team.
We are your team leaders. You will have 2 physicians caring for you during your rehab stay. A hospitalist will coordinate your daily care and follow up with your health concerns. You will also be working with a physiatrist, who is your stroke rehab specialist and will look at the big picture to help you restore function. The two collaborate closely to help you during your recovery journey.
We are the team member you will see the most. We are here with you 24 a day to help you obtain maximum function and health.
We're movement specialists. We will help you regain strength, coordination, and balance to increase your mobility and your independence.
So we will help you return to your typical daily activity, access your home, recommend assistive device and equipment to improve your independence.
We will help you with your communication and swallowing needs. This might include things like speaking, finding words, expressing ideas, understanding, reading, writing, and thinking.
We will help you work through the exercises given to you by your therapist, as well as providing support during your treatment sessions.
We will provide support for you as well as with your family during your rehab stay. We will help you navigate discharge process by reviewing discharge options with you.
We can personalize nutritional recommendations to support the management and the prevention of chronic illness, such as diabetes, for example. We can also provide you with advices that optimize your healthy lifestyle as a stroke survivor.
We have expertise to ensure that you are on safe and effective medications and are here to answer any questions you may have about your prescriptions.
We will help you get where you need to be, and we will make sure you are on time to all of your therapy sessions, and will accompany you on appointments within the hospitals. We are easy to be identified in our bright blue shirts.
We offer non-denominational religious and spiritual support based on your needs, or you may just want to talk. We create a safe space where you can express your feelings, talk about your challenges, and process the life challenges you are spiritually facing.
We provide support to ensure the smooth, efficient running of the unit by acting in the capacity of the Resource Center. We're happy to help you find the answers to your questions.
We keep the unit running smoothly and are here for you and your loved ones throughout your stay.
So the care at Bruyere is informed by best practices and the current research evidence. Doing research at Bruyere allows us to be a part of creating the evidence so that the research can inform our clinical care and we can in turn inform the best practices. If there's a research program going on, a member of your circle of care, so that could be your physician, your nurse, your therapist, they are aware of the research and they might identify you as being potentially interested and suitable for a particular research study. If you are suitable, they will ask you if you are interested to hear about research. And I would recommend that you always say yes, because there's absolutely no commitment at this point. If you do say yes, a member of a research team will come and talk to you and explain what research is going on and see if you might be interested.
Most people want to get back to life as they lived it before being in hospital. This often means improving strength and coordination, especially of their arms and legs, or improving balance and endurance, especially with walking and transferring from one surface to another. For many, it's improving safety and independence with self-care and addressing bowel and bladder care to restore confidence. For some, it's resuming cooking, managing medications, doing personal banking, getting back to driving, or going back to work. For others, it's improving speech and communication and swallowing. For many, it's managing changes to thinking skills, short-term memory, problem solving, attention, and visual perception skills. Lastly, for most, it's what can be done to prevent another stroke in the future. Rehab is about teamwork. Ask your questions to your rehab team. We are here for you.
Be present, patient, and a good listener. Ask a lot of questions to your care team. Knowledge is power.
Ask information in writing so you can review it again later. Try to keep all your paperwork organized in one place. Get your friends and family involved. Let them know what you are working on and how they can help you. Some people find it helpful to chat with other patients on the unit to share a story, find support, and maybe even a friend. Ensure your loved one has the necessary grooming items like a toothbrush and toothpaste, mouthwash, a hair comb or hairbrush, electric razor, deodorant, shampoo, and moisturizer. Make sure your loved one has comfortable, loose-fitting clothing that they can exercise in, about a week's worth. there is laundry on the unit. Ensure that they have good footwear for exercising, such as a sneaker or a comfortable shoe with a back and good grip on the sole. No heels, please. Bring in items that are comforting for your loved one and can help them pass the time, such as blankets, photos, books, magazines, a tablet if they use one, or knitting.
This is a collaborative effort between you, your family, and your rehab team. Bruyere has a home-first philosophy, which means that if home is where you want to go when you leave here, we will do everything possible to link you with community services such as the Lynn Home Care and other community resources. If you require ongoing therapy when you leave the inpatient unit, Bruyere offers a comprehensive outpatient stroke program where therapies and physician follow-ups can be provided in person or on a virtual basis. We will provide you with clear information about supports you have required in hospital so that you and your family know what is needed at home after you've been discharged from hospital.
We hope this video was informative and look forward to answering any questions you may have during your stay. Together, we will get through this journey.